To tell you a little bit about myself, my name is Scott Perryman. I'm a Battalion Chief with the wonderful department of Sacramento Metro Fire District in Sacramento. I'm currently a Battalion Chief, and I'm also in charge of the Mobile Integrated Health Program. We looked at the needs of our area, and we noticed that we had a lot of high 911 utilizers, and community paramedic programs are really good at that. But the other things that we noticed is we have a lot of people calling 911 for lower acuity issues, meaning medication refills, meaning I've got pain for months, various things that they're not necessarily emergencies, but they're more like urgencies. And as a community paramedic, you're not able to treat and release in the field. So we also looked at the psychiatric component. In working with our local facilities, they need to be medically cleared by somebody who has that license of a nurse practitioner, a physician assistant, or a physician. And the community paramedic wasn't going to work. So that's why we went with the advanced provider model, and we have seen just amazing success. The facilities are happy because they're actually getting the right patient to their facility. But also, more importantly, the patients themselves are the happiest. So we love seeing the success of the high utilizers are definitely going down. But the low acuity 911 calls, 70% of the time we're able to fix it right there in the field without them going into the emergency room. On top of that, the patient is saving hours and hours instead of being in the emergency room. And then on top of it, my crews are able to go back into service faster. So they're ready for that next call. You know, I love college football. Unfortunately, my football team lately has not been very good, but either way, I still love college football. And I like to associate it with, in the EMS system, a lot of the time, we throw the same resource at everything. We have higher call volume, we'll just put another ambulance into the system. We have, whatever the challenge in your area is, we always just simply add another ambulance. And that's not always the best fix. And having that advanced provider, that nurse practitioner or physician assistant, it's kind of like that football team. You have your paramedic, and so you also have that advanced provider, and you're able to bridge gaps. So again, going to that football analogy, you have a quarterback, and now you have a wide receiver. And so it makes a perfect team for somebody to see pre-hospital and to see hospital. And together, they're a pretty unstoppable team. I think there's another benefit to having that advanced provider that I think has to be talked about. I have 14 right now, 14 part-time advanced providers. They have full-time jobs in emergency rooms and other places. Them coming into the EMS system with their background has just been game-changing because they already are working in the hospitals, and then when they come into the program for the day, they're like, oh, that's one of our patients. Let me talk with this doctor and get them connected with this care or this care. We have one of our nurse practitioners she runs one of the burn clinics at UC Davis. She's incredible, and so to have that resource, there's nobody better who can deal with wound management than she does. But now she can also kind of connect with our own crews because she has that background of the fire side and understanding burns. And so she can connect with the crews, but then she can provide more of an advanced care with the patients who are having wound management. You can't, I mean, it just doesn't get any better than that. I could go on and on about our providers. A geriatrician who I took kind of a leap on because I'm like, she's a geriatrician, she doesn't have a lot of EMS background. Well, she had no EMS background. But her drive to understand EMS and her knowledge of geriatric issues, which, by the way, over 35% of our calls are for geriatric related issues, she can do stuff that nobody else could ever have even thought of. So I really wanted to bring out the value of having all these different backgrounds of these advanced providers and how they bring a little something to the plate and they just make the system better overall. So my advanced providers, they are what makes everything successful. Data is incredibly important in my realm because I need to convey the value of the program to politicians, to board of directors, to community leaders, to our own department. And so to be able to show this is what we have done, and this is what it all shows. To be able to go to people and say we're able to treat your issue 70% of the time in the field, and to be able to back it up. To be able to show that we have decreased the high utilizer use by over 43%. That's some real tangible values that everybody wants and needs, and then they say, well, where did you get that number? And be able to be like, well, I'm glad you asked, it is right here. So the value in being able to have it at your fingertips when you need it is just another benefit to the program that we have of ImageTrend, and we're very, very happy. Need to mention a name, Candace. She runs our ImageTrend from like the high level and does a lot of our data. Our MIH program has been very successful in like the number of calls. However, it didn't capture everything that we are doing, because when you just go to your administrator and say, we ran 4,000 calls, 8,000 calls, it kind of drowns it out after a while. It's just a number. But to capture all the things that are happening behind the scenes, oh, that's where the magic is. And so with ImageTrend, we're able to pull up the patient record, and we're able to document in there encounters, meaning there's an incident. Well, that's an easy one. They called 911, there's an incident. But what about those visits? You go behind the scene, and now you're talking to the patient, and you're like, did you pick up your medication? How did that appointment go with your primary care provider? What are the new challenges? That's just a visit. It's not an incident, but it's a visit, and there's value behind it because it adds up to why it's so successful. And so ImageTrend has allowed us to be able to document those visits, those phone calls, those text messages, those emails, everything that kind of makes a whole wraparound care. And to be able to have every provider who comes in to be able to be like, look at the patient and be like, scroll down and like, oh, we talked to you on this date, we talked to you on this date, and this date. So they're up to date when they actually are encountering the patient. They can say, I see that last week you talked with our physician assistant and this happened. How did it go since then? And that is something that has been fantastic to work with. When you're a larger organization, we're not the biggest out there by any stretch, and we're not the smallest, but we're running about 108,000 calls a year, 90% of them being medically related. You're asking about trends and how mobile integrated health has kind of impacted the system. It's kind of challenging because when you have one unit that's 7 days a week and a second unit that's 5 days a week, it's kind of like throwing a pebble or a rock in a pond. It makes a splash and it makes a ripple, but it's not like throwing a huge boulder in there, because in order to make a monumental change, then we need more units out there. So we know that we want to expand mobile integrated health, but what we can see is where we've been able to help with the psychiatric calls. A little example is there was a small study that showed that each psychiatric patient, when they go into the emergency room, they're there on average for about 30 hours. So that means that takes that hospital bed, and it's now inactivated, and that means that they're running the emergency room on less and less beds. So that means that my ambulance crews don't have another place to put that patient. It means they start getting stuck on the wall, and they call it ambulance patient offload time. We had 96 patients just last year that we were able to get directly into a psychiatric facility, whether that be an actual hospital, an urgent care, a respite center, or just resources. That's 96 patients, multiply that by about 30 hours, that's darn near close to 2,000 hours with just that one unit 7 days a week that we're able to make that impact on. So making a massive impact, we can't really see it, but we're really noticing that, okay, it did it here, we now need to expand it, and we're gonna see a lot more success. But more importantly, it's that one patient that we were able to help. That one patient who didn't have to stay on the wall for 30 hours before they got definitive care. So yes, we like to see these grandiose things, but what it really comes down to is that one patient at a time that we're gonna take care of. Our crews love the mobile integrated health program. The reason why is it just really boosts their morale because they're seeing those patients that they see over and over and over again. Now they're getting definitive care and getting kind of into the right direction that they need to go, instead of the only option is they just always take them to the emergency room. So the crews absolutely love it. The politicians love it because they hear the stories, but now more and more of them are actually starting to see it in their own life. We had a representative, he attended church, and the session of church just right prior to that, an individual got hurt, and they thought that they're gonna have to go to the emergency room, and then our mobile integrated health team showed up, did stitches right there on scene. The patient was able to stay there, finish the service, and everybody was talking about it after the service, and they were talking about how wonderful it was that their fellow colleague was able to be there and finish the service with them. And wow, we didn't know this even existed. And then when one of the board of directors came in, they were just very happy and proud and like, yep, we did that. The politicians are seeing the success because we can share with them the data, but more importantly, they're hearing the stories from the patients themselves because they're so happy with it. I have so many stories that I can't wait to share with you and others because it truly works. So the crews are happy, the patients are happy, of course the politicians are happy, and the insurance companies are happy because why wouldn't they be? The service is at a huge cost savings to them. So it's a win-win-win for everybody. I've been incredibly blessed because I have so many great people around me. We are not the first in the nation. We reached out to others that have really good programs. And I love bringing out LA City Fire Department and LA County Fire Department because they both have programs. But what I really find fascinating is going down and actually visiting them. So I visited with LA City Fire Department. They have one of these MIH teams along Skid Row. But then right next door, you have Beverly Hills Fire Department, and they have a program, and it's on Rodeo Drive. Vast socioeconomic backgrounds, but they have their programs that meet their specific needs. And so for others who are looking at this, you need to find out what your needs are, and you can customize it for what you need in your area. I love community paramedic programs. I don't want anybody to think that I'm against it. I think that there's a great application for it. You need to find out what your need is in your area and customize it, and you will find that, of course, you customize it for your needs, it will work well. Reach out to those because you're not alone. I reached out to others, and I hope others will reach out. Metro Fire is very willing to give as much information as we can so others are successful. Our only request is we were more than willing to share everything we have, make it better than what we have done, and then in return, it will eventually come back to us and we will all benefit together. So if you're looking for help, the help is out there, and there's just so many marvelous people. Again, you've got so many great programs out there. So build it for you and your community, and you're not alone. I think what is interesting is in the pre-hospital world, ImageTrend is definitely a force. You go anywhere in the country and you can say, I use ImageTrend as my documentation platform. They know what it is. In the hospital world, they use something called Epic. Epic is the big dog in the fight as far as the hospital world. I went to Epic and I shared with them my vision and what I was hoping to do. And Epic was like, that's really cool, but that's not really our cup of tea, so yeah, good luck. I went to ImageTrend several years ago, and they said, we have no idea what you're talking about, but if you think it, you can make it. So let's do it together. And it was fantastic to be able to work with ImageTrend, to be able to come up with this product on the community health side and make it exactly what we needed it to be. Is it perfect? No, it's not. There's no system out there that's perfect, but it really meets our needs, and it's really good, and it's been really helpful to have people who are willing to take a chance on you and to give you the building blocks that you need so you can build whatever you need. So ImageTrend, nice job, guys.